Well, today I have the pleasure of being at Low Country Orthopedics with Dr. Eric Stem. You're an orthopedic surgeon here, right?
Yes, I am.
Now tell me a little bit about your job and what you do.
So I'm an orthopedic surgeon. I have specialty training in joint replacements. I do hip, knee, and shoulder replacements.
And what would you say is your most rewarding part of your job?
I'm making people better. Folks that are in pain and have a limited quality of life can make them better and have a better quality of life.
Now we have some very interesting looking models in front of us. And today we're going to talk about how knee replacements are not a one-size-fits-all deal, that you need to actually make these personalized for every patient that you have. Now tell me a little bit about these.
So in general, knee replacements is sized to a patient, but one particular company, Conformis, has come out with a way to cost-effectively make knee replacements individualized based off a CT scan, because your knee is not shaped like my knee. And the idea is it's going to be a more normal feeling knee replacement and more comfortable.
So how does the process work when you have somebody that comes in that's having knee pain and you know they need to have a knee replacement? How do you approach that?
Well, first get x-rays, make sure they have arthritis and there's not some other reason for the pain. And then have discussion about if there's simpler things to do before surgery. Obviously try and do the simplest thing first. But if they've exhausted those simpler things, then a knee replacement may be their best long-term option for having improved quality of life and less knee pain.
And obviously over the years, technology has continued to get more and more advanced, and now we have the option to actually 3D print parts of the knee.
Yes.
So tell me all about that.
So 3D printing has become more common in joint replacement production of the implants. The Conformis knee, they actually take a CT scan, make a 3D computer model, and then print the molds similar to what you see here. It's one person only, and then from that mold make the implant that's going to fit that particular patient.
And we were just talking about how complicated the process is, or time consuming, I should say.
Right, it can be very time consuming, but previously, they had to make a mold, pour molds for every single one. Now they can 3D print based off of the CT scan that was modeled and make the knee replacement for each individual person, which previously that was not possible. It would just be too labor intensive to make a separate mold for every single patient when you're doing it by hand.
So other than how much quicker you're able to actually make these parts of the knee, what are some of the other benefits of 3D printing for knee replacements?
Something that fits you specifically. It is made to match your body. The guides that are used during surgery also are made to fit your bone. So it's all very individualized, and it removes less bone, maybe a quicker recovery, and hopefully a more normal feeling knee.
All right, so if somebody is interested in learning more about this technology and want to come see you, where can they go?
Low Country Orthopedics.